My name is Ashita Singh. I work at Chinchpada Christian Hospital as a physician. I also look after EHA's palliative care service. Palliative care is a service that looks after people who are suffering with terminal or incurable diseases. It deals with the holistic care of a person as they approach the end of their lives, including physical, psychological, social, and spiritual support. It is known that India is one of the worst places in the world to die. Only 2% of people receive appropriate pain medication towards the end of their lives. In Chinchpada, about 72% of the people, as per the last census, live below the poverty line. Many people have never heard of palliative care and don't have access to this very important service. So when we began, we actually had the uphill task of getting people to understand palliative care and what is provided. And gradually, we began to educate the community, and we were able to find patients in the community in large numbers. These people were often hidden in their homes, and their families didn't want to acknowledge that they were there because there is a lot of shame associated with these illnesses because of many misconceptions that people have about it being, a result of some sin that they had committed in their past, or that it was contagious, and we had to go find them and be able to care for them and dispel all these myths. So over the past 8 years since we started palliative care in Chinchpada, we've cared for over 700 patients, and at any given time we have about 90 to 100 patients on our current list. We also work very hard to acquire a license for morphine so that we could be able to stock and dispense morphine to our patients. Because it is not a service that is being requested, it will not be paid for. So palliative care at the moment must be a completely subsidized service. This is a high impact area of engagement with relatively low expense because we are not using a lot of technology, we're not using a lot of hospitalizations, and so those costs are relatively low. So if you or your churches are interested in getting involved with the palliative care work of EHA, you're most welcome to visit the website, and that will guide you to different ways in which you could be involved. It is a deeply transformative engagement. And this transformation is not only in the people that we serve and their families, but we find it also transforming us as healthcare providers. There is opportunity for deeper relationships when we go out with the palliative care team because it is a repeated visits to the home, and we are able to build relationships not only with the patient but also with the family, and many barriers to communication are broken down and strong relationships are formed. It has been a beautiful experience for us to dig deep into these questions and find the resources that we need to be able to ensure that people die with dignity and live a good quality of life for the rest of the remaining days of their lives.